Your dog's become a real couch potato lately and gained a little too much weight. So you've taken him out to the bark for a little exercise. He's excited and he takes off running. Then all of a sudden, without any warning, your dog starts limping. So you take your dog to an emergency pet center. He undergoes a thorough and a very necessary exam by a trained veterinarian, like surgeon Dr. Kent Stauffer.
If it's acute and it's sudden and it's unilateral and it's non-neurologic, it's most likely an ACL tear, anterior cruciate rupture.
Basically, the ligaments that hold your dog's knee together have snapped or ruptured, making it impossible to put any weight on the affected leg. Your vet advises the only remedy is through corrective surgery. So you schedule an appointment and admit your dog for the operation. Dr. Stauffer says the type of surgery depends on the extent and the nature of the injury.
The procedure of choice is per the surgeon and the numbers they've done and the success rates that they have. Because when we or I do a surgery of TPLO, I'm changing mechanics to circumvent the need for the cruciate, so when the dog loads the foot, stabilization is achieved. We are trying to make them better. We are trying to give them better legs to stand on for the future and slow arthritic change.
The procedure is similar to what you might expect if you were scheduled for surgery. The dog is kept calm and reassured by staff. The area to undergo surgery is shaved and prepped. Your pet is administered anesthesia and connected to sophisticated monitoring and breathing equipment. Then it's off to the operating room. Here you'll find the same sterile conditions and instruments you'd expect to see at your local hospital. ACL surgery, which can cost as much as $3,000 or more, has evolved over the years, significantly reducing the number of hours and improving the chances for recovery. Now, once the surgery is over, then it's our turn as pet owners to take care of our dogs. But there are some special instructions.
I want your dog in a living room watching TV. I want us to go outside on a leash, urinate, defecate, and come back in. At 2 weeks, we'll take those sutures out. At 6 weeks, we'll assess the healing, and then you can start to do some walks. There's variations with every surgeon, but for me, I'm protecting that leg well for that first 6 weeks.
The doctor says it's very important not to let your dog lick the incision for fear of any infections. Now, to keep the licking from happening, you can get one of those plastic cones that goes around their neck, or you can use one of these blow-up tubes that can go around the neck also, something like this. Another important part of recovery is to schedule regular physical therapy sessions with your vet. Dr. Annie Stafford says therapy begins when the stitches come out.
Important things that we do at that point are to regain range of motion that may have been lost because of the injury prior to surgery, or as a result of immobility after surgery. And we also want to restore muscle strength as well.
The thing to remember when we get home is to give our dog a healthy diet, weight control, and plenty of exercise. Sounds like the same kind of advice we need as the dog owners. There's one other thing, is that greyhounds are the one dog that will never have an ACL tear. It's just the way they're made. For Pet Pals, I'm Ken Nelson.